Okay. Good evening, colleagues. Good evening, my followers. How are you? Today is it's what? 23rd. Today is 23rd of November 2023, and we are beginning our live today. As usual, you will be asking any question of your choice, and I will be ready to answer. So thanks so much for those of you who are always watching Ask Dr. UTHUMAN live, and those of you who are following us on our channel, thank you so much for following us. And today, like I've already said, on my lives, I don't bring a specific topic. It's you to ask the question and I answer. So right away, I welcome you officially to this live today, and therefore we are going to begin with question number 1. And this question, everyone is still greeting me, but we are going to be ask any question. The questions I entertain, questions regarding fertility management. If you have an issue with fertility, you fail to conceive for a long period of time, those are the cases I entertain so much. All those are the cases I really understand, all I know best. Issues of infertility, you fail to conceive, issues of periods, things of that nature, things concerning fertility and so on. Those are things I really love and know best. So thank you so much for joining our live today, and we begin with questions from okay, all these ones. Hi doctor, good evening to you. All these ones are just still greeting me. Okay, let me go to question number 1. Tamara Mukandawire. Tamara Mukandawire. Where are you? This name is from which country? Tamara Mukandawire. Let me know the country you're from. Tamara Mukandawire is saying, hi doc, I went for an HSG test, and the conclusion was bilateral tubal obstruction, left midway and the right corneal region. Yes. So you went to the HSG. HSG is hysterosalpingogram. So you went to the HSG. They said you have those are blocked tubes, of course. You have blocked tubes. So what is your question? Because what I can see is that you have tubal occlusion or tubal ligation. In the right tube is obstructed, and the left midway is also okay. The left midway is obstructed, and then also the right corneal region. In other words, you have blocked tubes and it is bilateral. So what's your question? What's the question you want to know? What do you want to know about your blocked tubes? Okay. Tamara Mokandwide is saying it's from Zambia. All right, you're from Zambia. I have a lot of Zambian followers. Say hi to those guys. So okay, so what is your question, Miss Tamara Mukandavire? What is your question? Yeah, you're talking about blocked tubes, so what is the question exactly? Suberu, you're saying you're watching from Nigeria. Say hi to the Nigerians. Tamara is saying, what test can I undergo? You already did HSG and you found that the tubes are blocked. So what you're supposed to do is to go and the tubes get unblocked. There are many ways of unblocking fallopian tubes, okay? You can do what they call canalization or recanalization. You can do what they call, some people who do laparoscopy and others do tube flushing. I encourage canalization and laparoscopy. So Tamara Mukandawire, if you want to conceive, then you have to go and unblock your tubes. This is something which can be done. Yes, there is blockade at the corneal end. There is also blockade in the mid area you talked about, the midway, but still this can be managed. This is something you go to the hospital, they will unblock the tubes. So there is no problem about that. Okay, Anna Alice is saying, hey doctor, I have a question. My question is, why am I pregnant? Is why when I'm pregnant I feel my leg can't move. I can't go up to the bed. What causes that? Yes, sometimes especially that happens, especially when the pregnancy grows, you know, when you reach around above 20 weeks. When you reach above 20 weeks, there is compression. The fetus the baby compresses on very important structures, and therefore you'll have poor blood supply, especially in the legs, and that happens. So it's, to me, when I say it's normal, someone will say, you know, because it gives you inability. So it looks like as if it's not, it's as a result of the fetus compressing on your important structures, compressing on the inferior vena cava, compressing on the abdominal aorta, sorry, not inferior vena cava, but the abdominal aorta, yes, even in the inferior vena cava, and then the abdominal aorta. So those ones can cause that. So that is where it comes from. And again, also you may develop the weakness, because remember, when you're pregnant, you are sharing nutrients, blood, oxygen with the fetus, and therefore if you don't have enough, you'll get compromised. Then this one is saying, Arch Roosevelt Matu is saying, hi doctor, can one get pregnant within 5 days to the beginning of your cycle? No, this is not possible. You can't conceive when it is 5 days to your periods. That is not possible. We discussed about it. Check in one of my videos. I talked about the video. There is a video, I think it is my recent video, when you can get, because someone asked whether they can get pregnant during their periods, and also they asked whether they can get pregnant 5 days prior to their menses, and I answered that. Check in my videos, you'll see that answer. Check in my videos, there is that answer about when you can conceive during periods and the time before periods. So that answer is there. Aminat is saying, hello doctor, I did a pelvic scan, and the results are my uterus is bulky with 4.35 centimeters because of PID. I did HVS and MCS. What is MCH? MCS. Okay. Bacteria found was tough, and I have taken antibiotics. How do I know the PID has gone? Repeat the same tests, okay? The same tests you did, just go and repeat them. Because you'll do the ultrasound scan, you'll still do the HVS, then to determine whether the PID or the disease went. And, but again, if you're no longer having the symptoms, it is also an indicator that probably the disease is away, but what you're supposed to do is to go and do those tests. Repeat the tests to find out whether you are fine or not. Another one, Mildred, okay, Tamara Mukandavili is saying, thank you, Dr. Uthman, I will go for canalization. All right, okay. Mildred, hello, doctor, is there a medicine for unblocking the fallopian tubes? No, there is no medicine. There is no tablet, there is no injection that can be used to unblock fallopian tubes. This is done physically, either by tubal flushing, what we've talked about, or canalization, or that is the only way you can open the tubes. Otherwise, these people lying to you, there are many people out there, there are many quacks telling people that they have medicines, they have tablets. Here I can give you a jerry can of those. There are no medicines that unblock fallopian tubes. If the fallopian tubes are blocked, there are no medicines that can unblock them. So therefore, no one should lie to you that you can have you can have your tubes unblocked using those. It's only when you go for physical removal of the blockade. Then Naira News UG saying, hey doctor, what causes too much breast pain and back pain, also tubes pain before my periods? Help please, and I have failed to get pregnant. Now, what causes those pains? They are hormonal fluctuations, and I've already said here that it is fairly normal. Okay, it is something which is fairly normal, and it is as a result of hormonal fluctuations. So that is something you can't do. You can't have a solution for. So it is as a result of hormonal fluctuations, and if you don't want hormones to fluctuate, then it means you're not going to have your menses. So it happens as a result of hormonal fluctuations. Sanjay PS is saying, how to conceive a baby boy. How to conceive a baby boy? Sanjay, just have sex, unprotected sex on your ovulation day. If you have unprotected sex on your ovulation day, there are very high chances, around 99% of the chance, you're going to have a baby boy. So just have sex on your ovulation day. I hope you know when your ovulation day happens. You know how to calculate it, and you know the signs. Then Angoza, oh, this one is running away. Suberu boss is saying, Doctor, I have been trying to conceive for over 4 months. Now I don't know what is wrong. All right, if you don't know why you're not conceiving, do the following. Number one, go and do, I'm now talking to Suberu, Bose, and others who are in that category. 4 months, they are not able to conceive. Number one, go, your man needs to test. The man needs to do a sperm or a semen analysis. That is the first test he's supposed to do. Then two, for you are supposed to do a pelvic ultrasound scan. That is number one. Number two, you go and do a blood group test, and you need to also know the rhesus factor. Then number three, go and do fertility hormonal assay, and lastly, go and do an HSG X-ray. If you have those results, you'll be able to know why you're not able to conceive. Okay? Then Nachiriowa Aisha, doctor, I used the family planning, bracket and implant, good, for 5 years, and I'm not conserving, but did, what do you mean? I'm not conserving. All you mean you're not conceiving. Okay. But did a scan, and the doc confirmed that my uterus is thick. How can I treat it so that I conceive? Now, what might have brought the thickening of your uterus could be, it may be as a result of the hormones you used, because you used an implant. That is possible. It is also possible that your uterus is sick. Okay, you have endometritis, or you have something else. So what I would advise you, number one, is do a fertility hormonal assay. Perform a fertility hormonal assay. Let's know the levels of your hormones. Okay, that is number one. And by saying your uterus is thick, that is not where they will stop. That is not where they will stop. We need to do a clear analysis of your uterus. Yes, it is thick, because sometimes it can be thick when you are pregnant. Sometimes it is thick because you have endometritis. It can be thick. There are many issues, okay, that can cause that. So we need to identify and know what exactly is happening with your uterus. But bottom line, you need to do a fertility hormonal assay to look at the levels of your hormones so that you can get treatment and conceive. That is how implants behave. I was talking here, I think in one of my videos, I was talking about when to conceive after using an implant, and I explained clearly that most women, when they use implants, those hormonal family planning methods, most of them, when they use hormonal family plannings, after stopping them, they take long to conceive because these hormones interact and interrupt. They interact and interrupt the intrinsic, all the natural hormones of your body, and you end up failing to conceive. So that could be the problem, and you need to, what you need to do is to perform a fertility hormonal assay and correct that hormonal imbalance. Grace Joshua is saying, good evening, doctor. What is the meaning of endometrium is empty? Endometrium is empty. It means there is nothing in your uterus. Endometrium is the inner part of your uterus. Endometrium empty, it means there is nothing in your endometrium. It is empty, there is nothing. Okay, I remember as a Apophia saying, I began my periods on 13th and November, and ended on 16th November. What is my ovulation day? I don't know, Apophia. We cannot know your ovulation day unless we know the length of your menstrual cycle. We need to know the length of your menstrual cycle. So first let us know the length of your menstrual cycle. If we know the length of your menstrual cycle, we can tell you your ovulation day. Giving us the day you stopped periods is not important. But knowing the day you started the periods is important, but the day you ended the periods is not very important. But we need to know the length of your menstrual cycle and then the day you started your periods. So he's saying, Sengova Johan, doctor, how much is a fertility test? Fertility tests depends on the hospital you've gone to, because different hospitals have prices. There are those that are charging a lot and those that are charging a lot. So you need to go to visit those various hospitals and find out the prices. So I cannot tell you that the fertility hormonal test, all these tests cost such and such an amount, because I don't know which hospital you'll go to. Arch Roosevelt Matu, is the day is the day 14 days period comprising of safe days and unsafe days leading to ovulation consistent with menstrual cycles, normal or abnormal? If, am I understanding your question, Arch Roosevelt? Is the day 14 days period, bracket, comprising of the safe days and unsafe days leading to ovulation consistent with menstrual cycles, normal or abnormal? I think really ask this question again. Most people always say that the English is not Englishing. I'm not understanding this question clearly. Please ask it very well so that we can understand. Agonza Joseph is saying, thanks doctor, I'm a medical student in my 5th year at Gulu University. I like what you do. I wish to do the same and educate my community. I have learned a lot. Agonza Joseph, thanks so much for following, and I also send greetings to all university students, especially those doing bachelor's degree in medicine and surgery, and also those doing masters in different fields of medicine, especially those doing obstetrics and gynecology. I send greetings. I know most of you watch me, and thank you so much for loving me. And I wish you well when you're done with your studies. Yeah, you can come for some small coaching. This one is saying, Jeff Ifeyinwa, doctor, on September last 2 months, my menstruation came on 7th. And October 6th this month, it came on 5th. Today, 23rd November, I still see periods. Is it still normal? You saw periods on 7th of October, 7th of September. Then you saw periods again on 6th of October. And then 5th of November, then you're seeing 23rd of November. That is abnormal. Because from 5th up to 23rd of November, that is around 17 to 18 days. It is abnormal. Normal periods are supposed to be between 21 and 35 days. Anything below 21, abnormal. Anything above 35, abnormal. So that's it. Okay, so you're working on the other video. The video, we finished. Okay. So then another question here, someone is saying, Seburo is saying, thank you, doctor. Grace Ishua, doctor, can someone with left ovarian cyst 14.5 millimeters and 13.8 millimeters with no remarkable feature get pregnant? Yes. Yes, I will say yes. Yes and yes, it is possible. This is a very small cyst, but it is always better to first treat that cyst, to treat the cyst in order to avoid saying that I didn't conceive because of A, B, C, and D. So to have no issue with yourself, then you do. This one is saying, when do I use a 27 something? It's saying, when do I ovulate on a 23-day cycle? 23-day cycle, let's calculate for you. 23-day cycle. Okay, cycle. Someone over 23 days cycle, 23 days. We said that you get 23 minus 18. What do you get? Someone give me an answer there. 23 minus 18, what do we get? I'm waiting for answers. You people are not going to be giving you answers here. At least this simple one should be. Sengoba Jonah is saying 5. Yeah. Oh, everyone is now passing it. 5. So 23 minus 18, you get 5. Okay? So now, the person who asked about the 23-day cycle, from 5th, you begin your fertile days. Okay? From 1 to 4, these are safe days. So get 5 plus 4. What do you get? 5 plus 4. 5 plus 4. We are as if we are now doing abacus. This is now abacus. 5 plus 4, what do we get? People are struggling to get answers. You people. 5. Okay, someone is giving us an answer here. 9. So 5 plus 4, you get 9. Okay, yeah, everyone is now getting it. Empress, Sophie, everyone is getting it. So 5 plus 4, you get 9. Then 9 plus 5, what do we get? What do we get? The first person to give me the answer. 9 plus 4, 5, what we get? Okay, 14, everyone is now getting it, 14. All right, so now the person who asked the 23-day cycle, your ovulation day is on the 9th day. have sex on this day, there are very high chances, 9th day. On this day, you have very high chances of conceiving on the 9th day. Okay? So if you have sex on this day, there are very high chances of conceiving. So 9th is your ovulation day. But again, from 5th up to the 14th day, all these ones are fertile days, you can conceive. But from 15 up to the 23rd day, you are safe. You can't conceive. 15 to 21, and then 1 to 4 days, you are safe. You cannot conceive. So we proceed to the next question. We proceed to the next question. Oh, this question is right now. Where? Let me get the question. Let me get the questions. You know, when they come many, most of them scroll. The system scrolls itself. Okay. All right. This one is saying. Stella Jetty, hi doctor. Can ovarian cyst cause infertility? What can I do to be able to conceive? Meanwhile, I have fibroids, that is 4 millimeters in size. Please help with, thanks. All right. Now, you have two factors. You have two factors that can stop you from conceiving. Number one factor is an ovarian cyst. Though for it doesn't contribute a lot. But again, you have fibroids. So the moment you have fibroids will make it very hard, okay? It will be very hard for you to conceive if you have this ovarian cyst. So what I would request you is to do to first get rid of the fibroid. Okay, first get rid of the fibroid. When you get rid of the fibroid, now you can think about conceiving. Fibroids, I've always taught that fibroids you can do surgery and take away. That is what I do the myectomy. You can do surgery and take away the fibroid. Then you can do, you can use injections. There are some injections we use subcutaneously. Some of them go for up to 4 months, others go up to 6 months, but not that you're injected every day for 4 months or 6 months. We only inject you once in a month for a period of 3 to 6 months, and then the fibroid will go away. Anna Alice is saying, why when I give a birth to a child, hey, you mean birth, okay. When I give birth to a child after 4 months, I get my period. Then I doesn't receive any until I get pregnant. How can I know my cycle, doctor? Let us assimilate this question. Why when I give birth to a child after 4 months, I get my period, then I doesn't receive any again until I get pregnant? How can I know my menstrual cycle? Now, first of all, okay, we expect that someone will see periods after 6 weeks. That is normal to see periods after 1 month and a half of giving birth. Some people will continue, especially those people that will breastfeed. If you breastfeed religiously, that is breastfeeding regularly. If you breastfeed this child regularly, there are chances, or there is a risk that you may not conceive. You may not conceive, and still that you may not have your periods. Okay, so what you are supposed to do, what I advise you, is after conceiving, okay, you put a family planning method like an IUD, okay? Then you wean off this child, you take off the child, because you want to establish the length of your menstrual cycle. That's what you want to know. So wean off the child, take off the child from the breast. After taking off the child from the breast, you resume your menses. So when you resume your menses, you'll now be able to calculate your menstruation very well before you conceive. I think that's the idea, or that's the advice I can give you. Then, okay, another question. I remember Bazi, Apofia saying 35 days. 35 days, what is the question? Remind us. You gave us the question up there. You wanted what? You know, when you get questions breaking like that. Okay, you said I began my periods on 13th November and ended. Okay, what is my ovulation day? So you have a 35 days cycle. Let us know. You have a 35 day cycle. Let us calculate for you the length of your your ovulation day. You have a 35 days cycle. So here we have a friend who is having 35 days. 35 days. Okay, so you're going to calculate with me. 35 minus 18, what do we get? 35 minus 18, what do we get? People give me the answer. So we want to calculate for a 35 day cycle. 35 minus 18, what do we get? I want to give you the answer. Okay, someone is giving us 17. Everyone is now giving. Hey, naturally, Aisha, you're giving, it is 7. 35 minus 18, you get 7. Yeah. This abacus you studied here. We need to get our school fees we gave your primary teacher. Naturally, Aisha, we need to get back our school fees. You're giving us 7. So 35 minus 18, you get 17. Okay, that is true. So then 17 plus 4, what do we get? 17 plus 4, what do we get? Naturally, Aisha, please don't give us an answer. So 7, someone is giving us 21. 21, everyone is now passing this one. Naturally, don't give us an answer, please. You'll give us something wrong. And we need a refund from your primary teacher. So 17 plus 4, we get, people are giving, okay, 21. All right, 21, thank you. So 17 plus 4, you get 21. Then 21 plus 5, what do we get? 21 plus 5, what do we get? 21 plus 5, what do we get? Yes, give me an answer. 21 plus 5. Okay, people are giving me 26. Thank you so much. So we have 26. Now, the person who asked, if you have a 35-day cycle, this is your ovulation day. On the 21st day, that is your ovulation. From 17 up to 26, you can get pregnant. So your ovulation day is on the 21st. So have sex on the 21st day, you'll be able to conceive and conceiving a baby boy. Then, okay. Okay, so we got another question. These questions are many. These questions are really very many. These questions are very many. These very many. Okay. I retrieve the question. Okay, I think it's here. Vespa Okumi is saying, Hi doctor, I have burning feeling on my left breast for almost a month. Is your network okay? Is it okay? Okay. Vespa Okumi is saying, Hi doc, I have burning feeling on my left breast for almost a month now. I did an ultrasound scan before nothing was found. Planning to get pregnant next month. Could my hormones be imbalanced? Period is irregular. I have burning feeling on my left breast for almost a month now. Did an ultrasound scan before nothing was found. Planning to get pregnant next month. Could my hormones be imbalanced? I don't know. I can't know whether your hormones are imbalanced except if you do a fertility hormonal assay. So I would request you to do a fertility hormonal assay, okay? Do a hormonal test, find out whether your hormones are imbalanced. So you go and do a fertility hormonal assay. You can carry out FSH, LH, estradiol, and progesterone. Find out what is happening with you. Hello, how are you? Where are you calling from, and what's the problem? Hello, Murphy, how are you? Where are you calling from, and what's the problem?
I'm fine, doctor, but my network is very poor. I don't know whether you're getting me.
We are getting you.
Yeah, doctor, I would like to teach me about this app, this tracking period, meet you.
You're doing what?
Should I open my camera, then I put a green screen?
Okay.
Okay, let me try. My network.
Please be very fast because many people are in the line and we have very limited time. Sorry, I may put you off because you're not fast.
Mom, no.
Okay.
There is this green numbers. Zitegezachi. Ezo green numbers tosobola kufuna lubuto.
Green numbers on what? Green numbers on what?
On that app.
No, I don't use apps. I don't use apps when I'm calculating fertility.
Doctor.
I don't use apps, and because some apps mislead people. Because if you're to know your ovulation, your fertility days, we are supposed to calculate it, we must know the length of your menstrual cycle, etc. So to me, I don't encourage people to use an app, and I wouldn't want to engage myself in finding that using an app. Sorry, I won't use an app.
My network, doctor.
Okay, then we are answering this, and I think this is our last question. This one is saying, Doc, my period has stopped coming, but I sometimes feel pains on my abdomen. So if periods have stopped coming and you feel pain on your abdomen, I would request you to go and do a pelvic ultrasound scan. If there is pain on the abdomen or pain in the abdomen, and I know you're talking about the lower abdomen, okay? So you're meant to do a pelvic ultrasound scan to find out if there is any mass somewhere, okay? Do a mass, find out if you have a mass. If you have a mass, the mass will get treated, okay? So that's my advice. All right, I think we shall be ending this live today here. Thank you so much for watching me today. We've made it short today. We shall be meeting again next time on Thursday, same time. Those that have not answered their questions, please, next time I'll be ready to answer them, but time is gone. Thank you so much and have a blessed evening. Sign out.